Janet Aminoff. She'll be presenting social support for caregivers and CKD patients coping with anxiety and depression. Janet is a licensed clinical and certified clinical transplant social worker. She has been with the Northwestern Medicine Transplant for 18 years and is the clinical lead social worker. Janet has worked with all transplant recipients, heart, lung, liver, kidney, and pancreas, and their caregivers, but main focus has been with the liver, kidney, and pancreas population. All yours.
Thank you, Mateo. Thank you. Okay, do you guys want me to take my mask off, keep it on? What do you? Huh? Okay. Does anybody care? Okay, just because it might be easier for you to hear me if I don't have it on. Okay, so as Mateo said, I'm going to be talking about social support for caregivers and chronic kidney disease patients, dealing with coping with anxiety and depression. So there's a few things that we're going to talk about today. Some of the objectives are what is chronic illness, reactions to diagnosis, what to expect pre-transplant, and those are some of the things that we're going to go through is anxiety, situational depression, lack of control, grief, loss. So we'll go through all of those issues. We will also kind of go through a little bit as to what to expect during transplant. And sometimes with kidney transplant recipients, they are in the hospital for a shorter period of time as opposed to individuals who have different type of organs, but just some of the things that people can anticipate. And then what to expect post-transplant. Going through the medication side effects, survivor guilt, starting a family, resumption of sexual activity and intimacy, and then rejection, of course, and also kind of coming down to a new normal and acceptance of what your new life is. So before I get started with regard to talking about the different topics, my question to you guys who are physically here is, how many of you are recipients? Okay. How many of you are thinking about being considered for a kidney transplant? Okay. And how many of you just have a chronic illness and wanted to learn more about it or are caregivers? All right, wonderful. So it is a little bit tailored to both, but I am going to be talking about transplants since that is my area, okay? So feel free to stop me if you guys have any questions, etc. So chronic illness is basically, it's a disease or a disorder of slow progression and slow duration, which causes continuous or episodic periods of incapacity. Diagnosis, when someone is diagnosed with a chronic illness, they go through feelings of shock, denial, disbelief, anxiety, depression, anger and frustration, and then they come to some form of acceptance. Anxiety, as we all know, is basically feelings of nervousness, fear, apprehension, worry, and it can last 6 months or longer, and it also interferes with sleep or ability to function. Generalized anxiety disorder, which is a little bit more pronounced, is a chronic disorder characterized by excessive, long-lasting anxiety and worry about nonspecific life events, objects, and situations. The fear is unrealistic or out of proportion for the situation, and there's also difficulty in identifying the fear and controlling the worry. Panic disorder is also another form of anxiety, and that is a brief or sudden attacks of intense terror and apprehension. Leads to shaking, confusion, nausea, dizziness, and difficulty in breathing. It peaks after 10 minutes, but may last for hours. And it occurs after a frightening experience or a prolonged stress. Other anxiety disorders are social anxiety disorder, which is fear of being negatively judged by others. Obsessive compulsive disorder is thoughts or actions that are repetitive, distressing, and intrusive. And then post-traumatic stress disorder is a result of previous trauma, which leads to flashbacks and behavioral changes. Symptoms of general anxiety disorder, you would need to have at least 6 of the 18, which are often present. Trembling, twitching, or feeling shaky, muscle tension, aches, or soreness, restlessness, easily fatigued, shortness of breath or smothering sensation, palpitations or accelerated heart rate, sweating or cold, clammy hands, dry mouth, dizziness and lightheadedness, nausea, diarrhea, or other abdominal stress, hot flashes or chills, frequent urination, trouble swallowing where you feel like you have a lump in your throat, feeling keyed up or on edge, exaggerated startle response, difficulty concentrating, or your mind just kind of going blank. You want to say something, but you just don't remember what you want to say. Trouble falling or staying asleep, and then irritability. So, stop for a minute. In terms of you who are with us today, with regard to your anxiety as caregivers or as recipients, where did you see yourself as you were going through what you're going through?
I would say I'm going through anxiety. I think it's because I had a kidney transplant that lasted 21 years.
Wonderful.
And they call cancer in it, so I'm back on dialysis, and now I'm on the waiting list. And now, ever since they told me that I'm on call, I have the anxiety attacks.
Definitely. And we're going to be kind of talking about that, so thank you for sharing. Anybody else?
I just, my husband's had kidney transplant,
Mhm.
and he has other issues also, so I want to see how best I can help him with his anxiety or his stress.
Wonderful. Okay. Yes, no? Am I good?
You're good.
Okay, sorry. Okay, sorry. Okay, yes.
I believe I have very bad anxiety when it comes to, now my mom is on the donor list. She just got on the donor list in December. We're waiting for their call, but I firsthand witnessed a transplant that went bad with my grandfather, and he passed away 2 weeks after receiving his kidney. So it kind of, my mom and her, it prevented her from, because she's been on dialysis for 8 years.
Okay.
She's just now getting on the donor list because we both witnessed it.
Yeah, and it was hard for her, definitely.
So it's like, I'm nervous. It's like, so I have really bad anxiety just thinking, she's all I have, so.
Right, definitely. And that's understandable, and I thank you for sharing, because it is difficult. And hopefully with that wait time under her belt, with being on dialysis for 8 years, she should receive a transplant sooner rather than later. So, and you can't make that comparison, and we'll kind of go over some of that. Okay? Anyone else have anything? Yes, Gavin.
Well, not with kidney, but because I'm a liver transplant patient, I remember being in college, so about 19 or 20, when I started getting very sick with this liver disease and just feeling anxiety surrounding just like having to, it seems like, juggle one more thing, which was my personal health, along with either like schoolwork or regular work or social commitments, family,
Yep.
everything. Like it was just one more thing on top of everything.
Yeah. So great. Thank you all for sharing. We're now going to talk about depression. So what is situational depression? Situational depression is short-term in nature. It occurs when an individual is unable to cope or adjust to a particular source of stress. And that can be centered around a divorce, a retirement, a job loss, a death of a relative or a close friend, and also a diagnosis of a chronic illness. So major depression is severe despondency and dejection, It's felt over a period of time that can last at least 2 weeks on a daily or a near daily basis. It's accompanied by feelings of hopelessness, helplessness, and inadequacy, and it also impacts your ability to function in everyday life. What are some symptoms of depression? Well, you have to have at least 5 of these at the same time. A depressed mood during most of the day, especially in the morning. Fatigue or loss of energy almost every day. Feelings of worthlessness or guilt almost every day. Impaired concentration or indecisiveness. Insomnia, hypersomnia almost every day, and a decreased interest or pleasure in almost all activities nearly every day. Also, recurring thoughts of death or suicide, a sense of restlessness or being slowed down, and a significant weight gain or weight loss. What is anger? Anger is a strong feeling of annoyance, displeasure, or hostility. It can be a healthy emotion because we all need to express our anger one way or the other. However, it can also be corrosive, especially if we're emotionally abusive to our caregivers or to others, or physically abusive toward others because we don't know how to handle our anger. Frustration. Frustration is the feeling of being upset or annoyed, especially because of an inability to change or achieve something. An event or circumstance that causes one to have feelings of frustration, and then the prevention of the progress, success, or fulfillment of something. Lack of control is also a very common reaction when going through something like this because you're unable to control the situation. And so that leads to feelings of anxiety, stress, frustration, procrastination, guilt, disappointment, and feelings of being overwhelmed. You also, as a recipient or someone who has a chronic illness, have to rely on others for assistance. And that leads to a level of dependency, and that also impacts your family overall. So having to rely on others for assistance is being a burden. A lot of people tell me that. Or it can be role reversal. You know, you have to take care of one of your parents as a child taking care of one of your parents. And that can be very difficult for the parent to accept. There's also changes in your relationship with that individual because you're more of the parent and you should really be the child, and so the dynamics are very different. And there's also lack of communication because of the fact that maybe the individual who has the chronic illness, your loved one, doesn't feel comfortable in sharing with you what they're really feeling because they want to protect you. And so all of that plays a role. There's also feelings of grief and loss and just the impact of having or the thought of having a decreased quality of life. So your loved one may grieve over the loss of the dreams for the future or knowing that they may not be able to be present for you during life milestones. There's loss of identity because now they've been identified as having this illness and not able to be their own individual self. There's inability to care for themselves. There's also lack of independence, and then changes in relationship with family and friends that they're also grieving for. So, with regard to some of those feelings that I just kind of talked about with the depression and the lack of control and anger and frustration, would you say that all of you have experienced some of that throughout the process? Yeah. Okay, so you guys can all relate. All right, so when we're looking at surgery, there's always the anticipation of that surgery and the fear that it goes along with that. So am I going to receive a living donor or a deceased donor? And then you can also have a false alarm. So you can be called in for a potential organ offer, and then we're going to say to you, sorry, we went and took a biopsy of that organ. We didn't like what we see. Please go back home. We'll call you again when we have another option for you. So it really can be a roller coaster of emotions, okay? Also just the unknown, what to expect. You, of course, have already gone through a transplant, so you know what to expect this time around. But for other people who have not gone through it, or as a caregiver who has not gone through it, it's very distressing and overwhelming. And a lot of it relates just to the unknown in general. There's also the fear of dying on the table or waking up during the surgery. And I think if you have those fears, it's very important to share them with your physicians or your medical team so that everyone has a good understanding of where you're coming from. Because we do want to make sure that all of you are in a good spot before you go through the surgery, okay? Body image issues also are a concern for some people not, but some there is. And then also the level of pain that someone will be in after the transplant. So how do you cope emotionally? So important thing is to share your feelings with others and maintain open lines of communication with each other. Journaling. And I always say, you know, people think of journal, they think of, oh, writing down what we did for the day and how it went and good things that, you know, work, etc. For me, when I think of journaling, I think of writing down keywords for yourself. So if you were anxious or angry or depressed, is to write down why you were experiencing those emotions and then what you did about it. We all have coping mechanisms at our disposal, but sometimes when we're really anxious or overwhelmed, those coping mechanisms just don't come back to us. So by writing down what you did, it can also help you to kind of go back and look at it in the future to kind of see, oh, well, I did do this, and that was beneficial, so let me try this again and see if it works, okay? So it's really just building upon your coping mechanisms. Engage in cognitive reframing. With everything, there's always a positive and a negative. So the most important thing is to focus on the positive as opposed to the negatives. Engage in deep breathing exercises or relaxation techniques, guided imagery. If you guys have smartphones, there's free apps that you can download and listen to help alleviate some of that anxiety for yourself. The other thing is you can go to the library if you don't have a smartphone and not able to do that. There's tapes and different things like that that you can pick from the library. Connect with another patient who is post-transplant to normalize your situation and to obtain guidance so that you know what to expect. Knowing that each person's course is different, but at least it will give you a general idea of what to expect. Educate family members on those things that you can no longer do. A lot of times I see recipients where one of the individuals is really runs the household and does everything, and the other spouse or other family member that is with them doesn't know a lot of different things or what to expect. So it would help that recipient to share with their loved ones or family member what it is or what can be done so that you're preparing them for the future if something did go wrong, but also making you feel better and helping that individual have more control over the situation. Seek out individual counseling from a mental health professional. Attend a transplant support group. Consider an anti-anxiety or antidepressant medication. Make provisions for your family. Complete advance directives, a power of attorney for healthcare and/or a living will. And complete a will and testament. You know, a lot of people feel, well, if I do advance directives or if I complete my will and testament, then something bad is going to happen to me. And it's not, and anything can happen, as we all know, at any time in our lives. So it's important to make sure that your family knows what you want, what your wishes are, and can honor them for you if you are not here. With transplant and anybody who has a chronic illness, there's always financial burdens associated. So do I go on disability through my job? Do I apply for Social Security disability? When do I do that? What would be the best timing? How am I going to pay my bills and my insurance premiums if I no longer work? How am I going to afford my medications? How am I going to come back and forth from the hospital for my appointments and all my clinic visits and lab work? Am I going to be able to care for my family? If you're the breadwinner and now you have to go out on disability, how is that going to impact overall? And what do you need to do for it? And also, because of financial burdens, you don't do certain things maybe that you enjoy because that costs money. And so as a result of that, you're isolating yourself, which then can lead to depression. So there are some fundraising organizations out there. Now, they will guide family and friends on how to hold a fundraiser. They will not do it for you. So, but that is the information up there. The two organizations are Help Hope Live and National Foundation for Transplants. So I'll leave that up if anyone wants to take that information down for a little bit. And anybody who does donate, it would be considered a tax deduction. They will actually hold the money, so you will not pay taxes on any of the money that was raised. And also, it can help out, like if you were to receive a transplant and you had funds available, they will go ahead and, if there's enough money there, pay your rent for that particular month or your mortgage, okay? But mainly it is for medical expenses such as insurance premiums, medication copays, transportation, parking, all of those types of things related to that.
My husband, when he got his transplant, he had to have Medicare, even though he had his own private insurance from work. They insisted that he has to be on Medicare because there is some rule about that apparently. So
That is
he paid
correct.
2 premiums at that time.
Yep,
For 2 years, I think.
3 years. 3 years,
yeah.
but after January of this coming year, 2023, new legislation was passed. We don't know all the details yet that will allow people to keep Medicare beyond the 3 years.
Oh,
Okay? But yes, I believe I get into it, but if I don't, please ask about it at the end, and I'll be more than happy to kind of go over why Medicare is important. Okay? You're welcome. With medication assistance, there are assistance programs directly through the pharmaceutical company that is available to help out if you are financially strained. There are also value cards, or copay cards as we call them, that if you have private insurance, employer insurance, you are able to use those medication copays. Some cover up to $3,000 per calendar year, others cover up to $7,200. Okay? You can also get some of the medications that you may be on at Walmart, Costco, Meijer, or Sam's Club, or even RX Outreach for a reduced cost. Like some people can get their hypertensive medications, get a 3-month supply for $10 at Walmart. So you wouldn't even have to use your insurance if the insurance is much more expensive, okay? There's also the option of GoodRx coupons where you can obtain a medication without using your insurance at a reduced cost. So insurance, there's always the threat for loss of insurance coverage. Either you're unable to pay due to reduction in work hours because you can't work full-time, so now you're working part-time and now you may have to pay COBRA premiums, or you can't afford them because they're just too expensive. There is the possibility for individuals who do have COBRA to go ahead and extend it for another 11 months for a total of 29 months. But you would have to be approved for Social Security disability within 60 days of going on COBRA in order for that to occur. You may be ineligible for Medicare and or Medicaid. And if that is the case, then you could look at insurance through the marketplace or the healthcare exchanges. Okay. So let's just kind of talk about your question about Medicare, just to kind of, because I did not totally address it in there. So when people have end-stage renal disease, they are eligible and entitled to Medicare, okay, as long as you paid in the quarters, or as long as your spouse has. You are eligible based on dialysis or based on kidney transplant. And Medicare would always serve as secondary payer to employer insurance for the first 30 months. And then from month 31 until you are 3 years post-transplant, Medicare would be your primary payer. Okay? And that is the reason why we at transplant centers want people to be eligible, if they have Medicare, to be eligible, because when Medicare becomes your primary payer, your employer insurance can say, sorry, we only have to pay the 20% that we're responsible for. Okay? And we don't want you guys to get stuck with those bills. So there is a reason behind our madness as to why we ask that. Does that help clarify a little bit? Okay. Does anyone else have any questions about the insurance? Okay. So what to expect during transplant? As I mentioned earlier, sometimes people who go through a different type of transplant than kidney can be in the hospital for a longer period of time. So you don't really experience some of the delirium or the acute confusional state, but it can occur. And that is basically an organically caused decline from a previous baseline mental functioning that develops over a period of time, typically hours to days. People can also experience ICU psychosis. So let's say you have a complication, you need to go to the ICU. Basically, that is a cluster of serious psychiatric symptoms due to sensory deprivation, sleep disturbance and deprivation, and continuous light levels. Because you have all the beeps go off with the IVs and everything else, and so you're not able to sleep. Complications can also arise during the transplant. There can be anatomical complications that we don't see initially until we actually physically get in there. Others can be infection, and another can be a delayed graft. And sometimes what happens is when we give a kidney to somebody, it doesn't always respond right away. And so we call that a sleepy kidney. And so as a result of that, if that is delayed graft or considered a sleepy kidney, then we look at having that individual continue with dialysis even after the transplant for a period of time to kind of give that a kick start. And most people do okay with it, and it does kind of jumpstart the kidney. Sometimes it doesn't always work, and then we call that primary non-functioning. Okay? With the medication that people are on after the transplant, there is side effects from it. We at Northwestern do not use steroids unless people have an autoimmune disorder for kidney transplant. But steroids can cause mood swings, irritability, short-temperedness, and weight gain. Long-term immunosuppression can cause diarrhea, diabetes, cancer, cognitive deficits, and hand tremors.
That's what I had, cancer. That's what it had happened to me. It gave me cancer.
It did give you cancer. Okay, so it wasn't the cancer in the kidney itself, it was cancer afterwards that you developed. Okay. And then with receiving a transplant, there's always survivor's guilt that can occur. So why did I survive and others die? Sometimes people pray for someone to die so that they can get that love, that individual's organ. And some feel like they're not living up to the donor's expectations and question, well, what can I do to honor that donor, to make that organ not go to waste or that individual's life not go to waste? So how to address survivor's guilt? Acknowledge it, but don't dwell on it. Obtain assistance from family, friends, and mental health professionals by talking about your feelings related to it. Honor the memories of those who have died, and write a letter to the donor family. Okay? Now, I will say that when people write letters to the donor family, sometimes the donors don't always respond. The donor family doesn't always respond. And that doesn't mean anything. It just means that they may not be ready to acknowledge or to accept. But that doesn't mean that you shouldn't try again. Okay? There's also sexual problems that can occur after a transplant. People can experience fear of intercourse because if they engage in sex, it may cause damage to the organ. There could be some erectile dysfunction with regard to the men who receive a transplant, and there can also be vaginal dryness with regard to women. There can also be lack of desire or just pain in general with intercourse. So how do you resume that sexual activity or intimacy? Talk to a member of the medical team about potential options that might be available to assist. Over-the-counter water-based lubricants or vaginal moisturizers are also very good for women. Cuddling or giving one another a massage, all of those can create that intimacy and allow for that closeness and leading hopefully to sexual activity. And telling each other what you love about the other individual. Starting a family, we always tell people that when you want to start a family, it should not occur until you are 1 year post-transplant, okay? It will also be important for you to notify your MD prior to trying to get pregnant due to some immunosuppressants causing birth defects. So we always want to make some changes before you guys go ahead and start trying. It will also be viewed as a high-risk pregnancy. And if you don't feel that you can do this or you want to do this, but you still want to have a family, then consider alternative options such as surrogacy or adoption. Yes?
Does it affect men if they're on immunosuppressants?
It does. It does. Not as much, but it can. Mm-hmm. Rejection can also occur after a transplant at any time. And some of the potential causes of rejection is not taking the immunosuppressant medication as prescribed, not obtaining your labs on a regular basis, not reporting symptoms as they occur, not taking care of yourself. So, you know, some people who are under a lot of stress or anxiety or depression, we all know that stress is not good for our bodies overall, even though it's hard not to be stressed with everything that's going on in this world. But it is important to make sure that you take care of yourself. And if you are having some of those reactions, to let your doctors know or reach out to your medical team. Ask family and friends for assistance. That's important. Also, some people reject because they return to negative behavior. Some people go back to using substances that are not in their best interest and can do damage to these organs. Some also take medications that are prescribed by outside providers without clarifying that or clearing that through the transplant clinic, okay? Some of the doctors don't always know the interactions that people experience with the immunosuppression medication. So make sure that you do check with the transplant clinic if someone does prescribe a new medication that you've never been on to make sure that it is okay and will not interfere with the anti-rejection medications. So now we come to what is the new normal. So we've gone through the transplant, we're doing okay now, but you're never going to feel the same as you were prior to being diagnosed with your chronic illness. So you have to learn how to adjust to a new lifestyle, taking into consideration the limitations or the complications that you have experienced. Prioritize what is important for you, and of course, make the most of every day. So in conclusion, transplant can lead to an increased quality of life despite the potential for risks and complications. As I said earlier, it is an emotional roller coaster, but you can achieve success if you recognize that your diagnosis or illness affects not only you, but your whole family. Express your feelings openly with others or find a constructive avenue in which to release them, such as journaling, attending a support group, seeking out individual counseling, or even couples counseling with a mental health professional. And then also don't be afraid to ask questions or notify your medical team of any symptoms that you may be experiencing or any new medications that may be prescribed for you. And thank you, and I'll take any other questions or concerns that anybody has. Yes?
I just wanted to say that this is so comprehensive. I really appreciate your going through this. I kind of feel like every transplant person and their caregiver could benefit by seeing this. So thank you.
Thank you. Yes?
I want to ask a question. The other day, I was sitting in my car, and I just started crying.
Mm-hmm.
And was nothing wrong with me.
Mm-hmm.
What do you call that? Is that called? What's that wrong?
Well, it depends. It depends too. Are you on any medications, especially steroids?
And ever since
Oh, you're waiting on a call.
and
Okay.
ever since I'm on the list and I'm waiting on a call, I started having these panic attacks. I don't know if it's called panic attack. I just called it that. That's why I asked you, what is that called?
So as I had shown on the slide, the panic attacks are really more like clamminess, racing heart, hyperventilating, that type of thing. If you're not experiencing that, then it could be just like a letdown that phone call was not the call that you were expecting, okay? Or it could be too, sometimes with people who have like a prolonged hospitalization or who have difficulty going through this, it can create post-traumatic stress disorder. And so some of that could be that. I mean, like some people who had a bad experience at the hospital and now need to come back for their follow-up care, some people experiencing nausea or just apprehension or more anxiety because they have to walk through the doors of the hospital. And it just reminds them of what they went through. So it can be difficult. Yes.
Well, I'm somewhat biased because Janet has been my social worker with Northwestern ever since getting my transplant. But yeah, I would definitely emphasize how helpful the transplant support groups can be. So like OTS is here, organ transplant support. I wish that leading up to my transplant and then even immediately after transplant, that I guess the idea were kind of pushed on me more because I feel like during those times leading up to transplant and then especially right after is the times that I could have benefited best by being in a room of other transplant patients, other recipients, or other people waiting, just people that have walked a mile in your shoes a little bit.
Yep.
But it wasn't until a couple of years later when I joined the Secretary of State's office that I started to get brought to some of these support groups. And I just wish I had more prior knowledge about it too. But then also, I don't know if every hospital group or every medical system has transplant support workers. I should hope so because I remember getting my liver transplant at 23, and luckily at that time still being covered under my parents' health insurance. But pretty soon, 26 came upon me, and that was an age where I remember being very confused with having to change health insurance options and having to navigate the open enrollment or the health insurance marketplace. And just I remember how helpful Janet has been with helping me pick a health insurance plan, finding my medications when I didn't know how I was going to be getting my medications, just everything like that. So I would highly emphasize looking into your transplant support worker if your hospital or group has one.
Thank you, Gavin. Yes.
And so where did you find those support groups at?
Yeah, so I was brought to one by my coworker, which is, I believe it was at Christ Advocate, so closer to 95th. And I think that one started out as a heart transplant support group only, but I think has since opened up to any organ support or any transplant support. OTS is here, so they have a table. I know they were in person, but I think are meeting more towards more
Zoom.
so virtual type meetings. So
Yeah,
that's
it's
convenient.
virtual now on
That's
Fridays.
convenient for anybody to potentially join. You can just give them your name and email and get signed up that way. It's great to just talk with people medication questions, insurance questions, but just with other people that have been recipients or are other caregivers or, yeah.
Yeah, it really does help. And I think, I know through OTS, I believe you guys also go ahead and can link people up to other individuals who've already been through a transplant.
And it's many online, so many online.
Yeah,
Mhm.
I know she's a part of like a group online, like on Facebook and stuff, and I
Yep.
think they're very helpful because like a lot of stuff that we didn't even know, like about like the after effects after having your transplant and like the shakes, the handshakes, and the things that people just live with after the transplant, we never knew about it. And it's very helpful to know before going in, to know these things, and it won't be a shock when you
Right.
go through these things. But I was just looking for something like the Zoom or things like that.
Mm-hmm. Yep.
They have one called before and after transplant. It's online too.
It's on, I just Googled that.
No, it's on Facebook.
Facebook?
Organ
Before and after transplant. It's by Jim Myers. He runs that program. Jim Myers.
Jim Meyer.
Just a little bit of humor. My husband met another person who had had a transplant, and they were talking to each other, and they both came up with this. They said, "Yeah, COVID never affected us because we were using masks even before COVID. We were used to the mask
Right.
with going everywhere, and now we're fine. We're one of the pioneers of mask wearing."
It's very true. I mean, some people who were not, always aware of everything and the importance of hand washing and that type of thing are much more on top of that now because of COVID.
Yes.
So yes.
So with transplant, they were immunosuppressed, so they
Right.
had to do that
Anyway.
already, anyway.
Correct. Yep.
Of course, my husband takes it to the extreme.
Mm-hmm.
I mean, he is a bit OCD about it, but it's good.
Yeah.
It's good, I guess.
It is good. All right.
If I sneeze once in the house, I'm away. I've got COVID,
No.
Stay away.
Stay away is right. All right. Any other questions? Okay. Well, thank you all for coming. And hopefully you found it helpful.